Hi, good morning, everyone. I'm Marian, and today I will deliver into the significance of cultural safe practice and effective communication in healthcare. In this presentation, I aim to enhance our understanding in four key areas: the health disadvantages faced by Aboriginal and Torres Strait Islander people, the profound influence of culturally safe practice and effective communication in Australian hospitals, the pivotal role that nurses and midwives play in addressing these issues, and practical strategies we can implement in our workforce. Can't really serve any questions you may have until the end of the presentation. Let's start by exploring the health disadvantage faced by Aboriginal and Torres Strait Islander people in Australia. Aboriginal and Torres Strait Islander people in Australia face significant health disadvantages compared to the non-Indigenous population. These disparities stem from a complex interplay of factors that have accumulated over generations. According to ABS, over 40% of Indigenous individuals have one or more chronic conditions, with similar rates for males and females. However, there is a notable geographic disparity, with higher rates in non-remote areas compared to remote areas. These health disadvantages are deeply rooted in historical and socio-economic factors, including the traumatic consequences of European settlement, such as land dispossession, forced removal of children, and disruption of cultural practices. Ongoing discrimination and socioeconomic disadvantages further contribute to the persistence of these health disparities. To address these inequalities, comprehensive approaches are needed that recognize the intergenerational nature of the problem. This includes empowering Indigenous community, promoting cultural safety in healthcare, and addressing the social determinants of health. Collaborative efforts among Indigenous communities, healthcare providers, and policymakers are crucial for developing strategies that respect Indigenous rights, values, and aspirations. By acknowledging and addressing these underlying factors, Australia can work towards achieving health equity and improving the overall well-being of Aboriginal and Torres Strait Islander peoples. Now, let's delve into cultural safe practice and effective communication and how they are experienced by Aboriginal and Torres Strait Islander people in Australian hospitals, posing barriers to achieving equitable health outcomes. Culture safe practice and effective communication play a vital role in healthcare by recognizing and respecting the diverse cultural beliefs, values, and practices of individuals and communities, particularly those from marginalized or minority societies. It involves developing cultural competence to create an inclusive and empowering environment where individuals feel safe and included in their healthcare experiences. Unfortunately, Aboriginal and Torres Strait Islander people have encouraged barriers in accessing culturally safe and effective communication when seeking healthcare advice in hospitals, stemming from historical and ongoing traumas, colonization, and systemic health inequality. Effective communication can foster trust, understanding, and collaboration in healthcare interactions, ensuring patients feel heard, valued, and actively involved in their care. However, Indigenous individuals often face challenges in assessing culturally safe practices and effective communication due to language and cultural barriers, as well as failure to consider the cultural context. These obstacles hinder the establishment of trust and rapport, ultimately impacting the delivery of patient-centered care. It is crucial to enhance cultural competence, prioritize effective communication strategies, and consider the cultural needs of indigenous patients to address these imperatives. So, what is the role of nurses in addressing culturally safe practice and effective communication? Nurses and midwives have a crucial role in promoting equitable health outcomes by developing skills in culturally safe practice and effective communication with their clients. They play a significant role in enhancing cultural competence and providing culturally appropriate care. It is essential for nurses and midwives to create a safe and inclusive environment that respects the cultural beliefs, values, and practices of individuals and communities. Effective communication, coupled with respect for an indigenous dignity, culture, values, beliefs, and rights, is vital, particularly when providing care to Aboriginal Australians. Nurses and midwives are responsible for delivering culturally appropriate care, acknowledge the impact of historical and ongoing traumas, and actively working towards reducing health disparities experienced by Aboriginal and Torres Strait Islander peoples. By embracing these responsibilities, nurses and midwives contribute significantly to improving health outcomes and well-being while promoting cultural safety and effective communication in healthcare settings. Through active engagement in effective communication strategies, nurses and midwives can overcome language and cultural barriers, establish trust, and foster understanding in healthcare interactions. The provision of culturally safe practice and effective communication should align with the principles of respect, inclusivity, and cultural sensitivity. To ensure culturally safe practice and effective communication for Aboriginal Australian patients, several realistic strategies can be implemented in the hospital workforce. Firstly, organizing cultural competence training for healthcare staff is crucial. This training should focus on enhancing their understanding of cultural diversity, including cultural norms, traditions, and communication styles specific to Aboriginal cultures. By fostering empathy and promoting effective cross-cultural communication, healthcare providers can deliver care that respects the beliefs, values, and practices of Aboriginal patients. Secondly, considering the employment of bilingual staff or interpreters can help overcome language barriers and ensure accurate and meaningful communication between healthcare providers and Aboriginal patients. This promotes effective communication and ensures that important information is conveyed and understood correctly. Creating a culturally inclusive environment within the hospital is also essential. This can be achieved by incorporating diverse cultural elements in the hospital's design, patients' activities, and dietary options. Such measures make Aboriginal patients feel valued, respected, and more comfortable in the healthcare setting. Encouraging healthcare staff to actively listen, be open-minded, and adopt their care approaches to meet the individual cultural needs of Aboriginal patients is crucial for effective communication and cultural safety. Lastly, regularly seeking feedback from Aboriginal patients and their families about their experiences and satisfaction with the care provided allows for continuous improvement and ensure that the hospital's practices align with cultural safety principles. By implementing these strategies, hospitals can create an inclusive and culturally sensitive environment that promotes equitable healthcare outcomes for all patients, including Aboriginal Indigenous. In summary, this presentation emphasized the significance of cultural safe practice and effective communication in healthcare, particularly for addressing the health disparities faced by Aboriginal and Torres Strait Islander people. It highlights the role of nurses and midwives in promoting equitable health outcomes and provided practice strategies for implementing cultural competence and inclusive practice in a hospital setting. By embracing these strategies, healthcare providers can improve cultural safety, overcome communication barriers, and deliver person-centered care to patients from diverse cultural backgrounds. Thank you for the listening.